Hello guys, what's up? It's the Moody Medic here, and let's start today's topic, which is cervical plexus. So I've already made the cervical plexus. Just don't get baffled that it's so difficult. I'd make it on the paper in the end of the video and you will just know that how easy it is. Alright, so first, studying cervical plexus, there are certain things that you need to know priorly. First is that its location. Its location is in the posterior triangle of the neck. Obviously its name is cervical, so it would be present in the neck or the area around the head. Alright, and plexus, always remember that plexus means that there is a network of nerves that is communicating together and supplying certain skin and fascia structures and muscles. And also remember that whenever there is a plexus, be it brachial plexus or cervical or lumbar or any plexus, it is always formed from the anterior rami of the spinal nerves. Since it's the cervical plexus, so it would be formed by the anterior rami of the cervical spinal nerves, and more specifically which one? C1, C2, C3 and C4. So these are the cervical spinal nerves which form the plexus. And also there is one thing that you need to remember, that is these are the spinal cord segments and not the segments of the vertebra or the vertebral column. People tend to confuse the two. Alright, so there's certain muscles that you should know before understanding cervical plexus. If you know these muscles, it would be really easy for you and you will just pick it in minutes. Okay, so the first set of muscles is suprahyoid muscles, and we know that there are four suprahyoid muscles. MSGD is the mnemonic that can make you remember suprahyoid muscles. So the rule is that this mylohyoid, stylohyoid, geniohyoid and digastric muscles, out of all of the suprahyoid muscles, are supplied by the cranial nerves 12, save the geniohyoid, which is supplied by the cervical plexus. C1 is the root which supplies it. So we'll see it in a minute. Infrahyoid muscles. The another set which you need to remember is infrahyoid set of muscles, and you can remember it by the mnemonic TOS. So TOS means TOS represents thyroid muscle, omohyoid muscle. It has two bellies, sternohyoid and sternothyroid. So one thing that you need to know is that the S in infrahyoid muscles is for sterno and the S in suprahyoid muscles is for stylo. Alright. And then there is another group of muscles, prevertebral muscles, which are two recti and two longus capitis and longus cervicis muscle. Always remember that whenever we talk about capitis, it's something related to head or skull, and when we talk about cervicis, it's related to neck. And for cervicis, we can also call it sorry, it's not cervicis, yes, it is cervicis. I thought it's crevices. So, all right, so longus cervicis, you can also call it longus colli, because in Latin, collar is in Latin, the word collar or column is for the neck, and hence the longus colli name. Alright, so now starting the cervical plexus. Cervical plexus first branch is from C1 and it will divide into two branches. It will give two branches to two muscles. First it is geniohyoid muscle, and we discussed the geniohyoid muscle is the suprahyoid muscle, only suprahyoid muscle which is supplied by the cervical plexus. So C1 would be supplying it, and then there is another muscle, thyroid muscle, which is supplied by C1 directly. So thyroid muscle is infrahyoid muscle. So first of the infrahyoid muscles is done with cervical by C1. Alright, so there is another thing that you need to know, that cranial nerve 12 comes and goes along with this C1 branch. So it goes like they are both going together. So the C1 of which is supplying geniohyoid and thyroid from the cervical plexus is going along cranial nerve 12. Cranial nerve 12 will further go and divide tongue muscles. And there is another rule for tongue muscles, that there are four tongue muscles. So out of the four, three muscles would be supplied as the genioglossus, hypoglossal and stenoglossus. They would be supplied by the cranial nerve 12, that is the hypoglossal nerve, this. But except for the palatoglossus. Palatoglossus would be supplied by some other nerve. And also the intrinsic muscles of the tongue would be supplied by cranial nerve 12. So this was about cranial nerve 12, which is going to tongue and taking along the muscle that would supply one of the suprahyoid, that is geniohyoid, and the another infrahyoid, that is thyroid. Alright. So now, firstly I'll talk about the muscular branches and then about the sensory branches. So C2, now talking about C2 along with C3 will form a loop, and this loop will go and join C1. This loop is called ansa cervicalis, and it has two roots. One is this inferior root, because you can see it is coming from C2 and C3, and this is the loop, and then there is the one which is connecting to C1, it is the superior root. Now it will give four branches. The first branch would be to the superior belly. Alright, ansa cervicalis, the rule is it will supply all of the infrahyoid muscles. Alright. So the infrahyoid muscles are TOS. We have already done thyroid. So the next is superior belly of omohyoid, the toss. Out of toss you've done O, now we are doing omohyoid. This is obviously, if it is superior belly, it will be supplied by superior root. After then there is omohyoid. After omohyoid there is sternohyoid, then there is sternothyroid, and then there is another muscle which this inferior belly of omohyoid. So that's about it. These are now all of the infraoid muscles are done. Thyroid, omohyoid, sternohyoid and sternothyroid. All four of the infraoid muscles are supplied by ansa cervicalis. And this is the inferior root, descending root, and this is the superior root of the ansa cervicalis. We are done about this. So also you need to know that from C5 there are certain muscles that are supplied, certain branches going to certain muscles. There is this rhomboidus major and rhomboidus minor branches, which have their supply from C5, and the nerve would be basically dorsal. The nerve would be dorsal scapular nerve. Yeah, it would be dorsal scapular nerve. Then there is serratus anterior. Serratus anterior is supplied by C4, C5. So it would be, the nerve would be long thoracic nerve. Then there is another muscle which is levator scapula. So these muscles are also getting some parts of their supply from the brachial plexus, which starts from C5 to T1. So C5 to T1 is brachial plexus. So these are also getting the roots from C5 and then from the brachial plexus as well. Now it's done. Now we'll talk about some of the last motor branches. And yes, C1 and C2 were combining to supply the prevertebral muscles. That is the rectus capitis anterior, rectus capitis lateralis, longus colli, and longus capitis. Colli also said that longus is also longus cervicis. Now the cranial nerve 2 and the cervical nerve, spinal nerve 2, C2, C3 and C4 will again form a loop, and this loop will be connected with cranial nerve 11, that is the accessory nerve. So accessory nerve would be connected, and the C2 and C3 would also supply the sternocleidomastoid muscle. So this is another muscular branch. Then there is this trapezius, which is supplied by C3 and C4, and the sternocleidomastoid and trapezius supply is basically the sensory supply, and its motor supply will come from the cranial nerve 11. So that's why it's going along cranial nerve 11. So these are some of the communicating branches, just like that communicating branch which was going with cranial nerve 12, that is the hypoglossal nerve. So now we have done almost all of the muscular branches. There are certain branches which also supply scalenus medius and scalenus anterior muscles from the cervical plexus. Now let's talk about the sensory branches. There are 4 sensory branches, and you can remember them by the mnemonic OATS. Alright, we'll see how it puts together in the cervical plexus. Firstly, let's talk, there is this branch that is coming, since first sensory branch is called lesser occipital nerve. Lesser occipital nerve is coming from C2 only. Alright, the second cervical spinal nerves, which are cutaneous or sensory in nature, are made from C2 and C3. The C2 and C3 will join, and then it will divide into 2 branches. First would be greater auricular nerve, and the second would be transverse cervical nerves. Okay, transverse cervical nerves, it is also called anterior cervical nerve, transverse cutaneous nerve, anterior cutaneous nerve. And the last and the fourth one is suprascapular nerves. All right, no, let me confirm, it is supraclavicular nerves. Sorry, supraclavicular nerves. So the supraclavicular nerves has its root value from C3, C4, and there are basically 3: intermediate, lateral, and medial suprascapular nerves. So now we are done with all of the motor, all of the sensory nerves, and now you can see how the mnemonic OATS fits on it. This is lesser occipital O, auricular A, transverse cervical T, and supracervical. So OATS, OATS. That was about it. So last and the most important branch of cervical plexus is getting its root from C3, C4 and C5, and it's forming the phrenic nerve, which is the only supply to the diaphragm. So yeah, that was about cervical plexus, and let's revise it in a nutshell. Cervical plexus is formed from C1, C2, C3 and C4. There are the muscular branches. First muscular branch is to geniohyoid, which is the intrahyoid muscle, and second is to thyroid muscle, and these are going along with cranial nerve 12. Then C1 and C2 join and form all and supply all of the prevertebral muscles, and then C2, C3, and C1 join and form ansa cervicalis. Ansa cervicalis is supplying three of the infrahyoid muscles. Now all of the infrahyoid muscles are done, plus one suprahyoid muscle and the prevertebral muscle. There are some other muscles which are supplied by C5, and they're having C5 root along with others in their supply, which is rhomboides major, minor, and levator scapulae muscle, and the serratus anterior muscle. Then the sensory fiber or the proprioceptive fibers of sternocleidomastoid and trapezius are going from the loop which is formed by C2, C3, and C4 along with cranial nerve 11. That is the accessory nerve. This is done about the muscular branches. Then there is this phrenic nerve which is formed from C3, C4, and C5 and is going to the diaphragm. And it is a mixed nerve. Then the four sensory branches, OATS. Lesser occipital nerve by C2, C2 and C3 are forming greater auricular nerve, and transverse cervical nerve C3 and C4 are forming suprascapular, supraclavicular nerves. I don't know why, just confuse it. So that's about it. Thank you guys for watching. Please like, share, and subscribe.